Case Study 5-1 Emergency Care. During a triathlon, paramedics responded to a scene with multiple patients involved in a serious bicycle accident. BR, a 20-year-old woman, lost control of her bike while descending a hill at approximately 40 miles per hour. As she fell, two other cyclists collided with her, sending all three crashing to the ground. At the scene, BR complained of pain in her head, back, chest, and leg. She also had numbness and tingling in her legs and feet. Other injuries included a cut on her face and her right arm, and an obvious deformity to both her shoulders and knees. She had a slight difficulty breathing. The paramedic did a rapid cephalocaudal assessment and immobilized BR's neck and a cervical collar. She was secured on a backboard and given oxygen. After her bleeding was controlled and her injured extremities were immobilized, she was transported to the nearest emergency department. During the transport, the paramedic in charge radioed ahead and provided a pre-hospital report to the charge nurse. His report included the following information: occipital and frontal head pain, laceration to the right temple, superior and anterior to the right ear, lumbar pain, bilateral thoracic pain on inspiration at mid-clavicular line on right and mid-axillary line on left, dull aching pain of the posterior proximal right thigh, bilateral paresthesia or numbness and tingling of distal lower leg circumferentially, varus knock-knee adduction deformity of left knee, and posterior displacement deformity of left shoulder. At the hospital, the emergency department physician ordered radiographs for BR. Before the procedure, the radiology technologist positioned a lead gonoidal shield centered on the mid-sagittal line above BR's symphysis pubis to protect her ovaries from unnecessary irradiation by the primary beam. The technologist knew that gonoidal shielding is important for female patients undergoing imagery of the lumbar spine, sacroiliac joints, acetabula, pelvis, and kidneys. Shields should not be used for knee examination in which an acute abdominal concussion is suspended. Okay, case study questions. Number 1. The term for the time span between injury and admission to the emergency department is B, pre-hospital. A cephalocaudal assessment goes from C, head to toe. 3. The victim's injured extremities were immobilized before transport. Immobilized means E, held in body alignment to keep them from moving. Number 4, a cervical collar was placed on the victim to stabilize and immobilize the what? And that was the D, neck. And 5, the singular form of acetabula is B, acetabulum. Okay. So here is my diagram. So number 6, draw a dot over the area of the victim's occipital and frontal lobe pain. Right there. Draw a dash over the area of the right temporal laceration. Right there, number 7. Number 8, shade the area of lumbar pain. Right there. I didn't label it. That's number 8. Number 9, shade the area of thoracic pain at the mid-axillary line on the left. That is right there. Number 10, draw a star at the area of the pain on the right proximal posterior thigh, right up in this area. Number 11, shade the area of the bilateral paresthesia of the distal lower leg circumferentially. That's these down there. Number 12, draw an arrow to show the direction of the varus adduction of the left knee. There you are. Number 13, draw an arrow to show the direction of the posterior displacement of the left shoulder. Right there. 14, draw a fig leaf to show the gonoidal shield on the mid-sagittal line above the symphysis pubis. Right there. And number 15, draw a circle around the area of the sacroiliac joints. And there's the circle. Thank you.